My name is Reuben. I was diagnosed with cystic fibrosis about 3 days after birth. My sister, born a year before me, passed away three days after birth because of complications, and after the autopsy they found that she had cystic fibrosis. I'm 28 years old, so this was kind of still in the discovery period of CF. Not necessarily discovery, but kind of on the edge of what we know as modern medicine or modern treatments towards cystic fibrosis. So it was still not a standard testing at birth. It had to be requested. A lot of times now, that's just a standard procedure. Even beforehand, parents are getting tested to see if they're genetically disposed to having a child with cystic fibrosis. That was not the case then. But they were ready for it when I was born, and they expected it. There was a high probability that I would have it, and so I was diagnosed early on, and then they, of course, did the sweat test and that good stuff and confirmed it. As far as my life early on, I don't remember ever really having too many issues because of it. I went to school. I was in and out of schools because my family moved around a lot, but I was in public school. I was homeschooled part-time, and a bunch of different things, but I don't ever remember it really slowing me down, especially not in elementary and things like that. I went to school. I didn't really think of anything different as far as that goes. I remember in middle school, I played sports. I was in soccer and a bunch of different things. I did drama in high school. And again, I didn't really notice it slowing me down until probably 14 or 15 years old. There were certain things, sometimes in gym class, I couldn't keep up, or I'd get winded, I'd get gassed really easily. I was sick more often, it seemed like, than my peers, especially in the winter time. And there was a lot of things that I didn't tell my parents. Things that I thought were just kind of standard. I thought, I just went through my daily business. I didn't think about the fact that when I was standing out on the bus stop in the cold in the wintertime, how much harder it was for me to breathe. I just assumed that that's how winter was. And so there was a lot of coping that I know now, looking back and working with other patients, especially younger patients, teens and adolescents, knowing that I was suffering from symptoms and it didn't register. And so I think that's to me is an exciting part where the medicine has progressed, especially pediatric care has progressed, that teaching children and adolescents to recognize their symptoms and things like that. But I didn't notice that for a long time. And so I just kind of carried on. I tried to stay as fit as I could in high school, and then I went to college. And in college, I went through I went through an accelerated program, so I kind of also lived the college experience at an accelerated rate. I had 3 months where I did whatever I want instead of the whole freshman year. I crashed and burned really bad. My grades dropped, and I said, okay, I need to fix this. I need to do something about what's going on. But again, even in college, I knew the symptoms that I had. I noticed them starting to catch up with me, but it didn't really, at least my first year of school, it didn't really slow me down. I was still going what I thought was 100%. And then came kind of turning point. And I want to illustrate something real quick. One of the things that I hear a lot, because I lecture with not just medical students, but also medical professionals. So I work with RTs and pulmonary doctors and nurses and things like that here at KU Med and at a couple of different hospitals as well. And one of the things that I hear all the time is, especially from medical professionals and other care providers, folks in schools and things like that, even parents, they don't know, they want to identify with their patients. They want to know, that experience, that thing that intangible. You can get all your book knowledge, you can get all of your credentials and everything like that, and understand everything about the disease, and understand everything going on, but you don't live it every day. And so one of the hardest things that I hear from doctors especially is it's difficult for me to put myself in their shoes. So I want to do a real quick illustration, and it's also going to tie in one of the things that patients do on a regular basis. When we come into the hospital, even just for a clinic, whether that's quarterly or every 6 months or something like that, you do your PFTs, your pulmonary function tests. So one of the standard ones to measure FEV1 or the forced volume capacity, or FVC rather, is taking in one long breath, holding it for about a half a second, and then expelling as much air as possible in one breath. So we're going to kind of illustrate that. I don't know if we had enough balloons. It was kind of first come, first served at about 150. So, but most people I think got their balloons. So what we're going to do is we're going to do one of the PFT tests real quick. And if you're uncomfortable doing this around your peers, it's too bad. I'm a crazy guy with a mustache in front, and I'm going to also be doing this as well. So what we're going to do is we're going to take one deep breath in. And I'm going to do this at the same time as you guys. One deep breath in, expand your lungs as much as possible, and blow all the way out into the balloon, and then hold it. And we're all going to tie them off. Okay? All right, everybody ready? Stretch it out. Or so fast balloons around. Okay, we got some balloons left. Who didn't get balloons? Raise your hand. Balloons, we got a couple over here. So while that's getting passed out, a little bit more about myself. I'm originally from the upstate New York area, near Buffalo. I worked with Women and Children's Mercy up there. I was on the CF advisory board up there, working as a patient advocate, working with the medical professionals to change and adjust the hospital protocols and work with, as a go-between patients and medical professionals, the care providers, rather. And then I'm also in that same role here in the state. So I've been back and forth between upstate and here. Anybody else? Got a couple left down here. Who else didn't get? We got these guys down front. We might just have enough. Excellent. Perfect. Look at that.
Except for you, yes.
All right. So we're going to do this all at the same time. One deep breath, hold it for half a second, and blow your air out. Ready? Ready? And. Try real hard. Try real hard. Okay. So we're going to try really hard. Anybody? Good guy. There we go. What's your name? Ethan. Thank you. All right. All right. So measuring lung volume. Okay. So this right here is going to be our initial look. So we're going to say he tried relatively hard. And you'll see, the difference right off. Okay? Now, to get into a patient's shoes, sometimes the best way is to understand how their activity or their daily life is limited because of the disease. It's sometimes something that can't really be quantified. It's a discomfort thing. It's a weird intangible. In this case, it's pretty easy to see visually. I don't know if everybody in the back can see, but this is what, if we were going as far as demographics and averages, which is how the FVC works. It takes the average averages of what a a standard adult male about my age athleticism. It's just averages across the board and what their lung function should be or lung capacity should be measured against mine, and then you get a percentage of lung function or a percentage rate. There's also exact liters and things like that. So this is what 100% should look like, roughly. And again, depending on your body type and athleticism and things like that, it can be more percent looks like, and this is what 27% looks like. So think about what just taking half of the air out of that balloon would do to your daily quality of life. What does that do? I even think of it in terms of walking from the parking lot where we all park out in the back nine to get down here. And being out of breath by the time you get here, or halfway getting here. A flight of stairs, what that's like. Going to the gym, going to your classes. What fatigue is like when you sleep all night. You sleep 4 hour, 6 hour, 8 hour, 10 hour night, and it doesn't feel like you've slept at all. So what does that do to your daily living? What do you have to put on hold? What things, social life, school life, what pace do you have to take to make up for that? So this is, and not to bring you down or anything like that, but it's to give you a quick perspective on, man, what would that do to my daily routine? Adding in an hour of treatments in the morning, pulmonary treatments, an hour of treatments at night, adjusting your meals and your nutrition and things like that. Now, Ethan, I'm sure, has got a crazy class schedule, and he's trying to fit in his social life and fitness and all this different stuff that he's got going on. My life revolves pretty well around the disease. I don't make it the center of everything, but it takes a piece of everything that I do. The nutrition, my nutrition regimen is extremely strict. I've got a whole lineup of what I do. My supplementation, fitness is a huge part of what I preach and how I live to keep myself alive. And doing that at 100% maximum all the time this is what I get, 27%. So again, not to bring you down, but to put you in your patient's shoes or your future patient's shoes to give you an idea of what that's like. So I had this turning point, to get back to my story. So in college, my last year of school, I had senior portfolio stuff coming up. I had job reviews coming up. I was engaged. I was going to get married in about 6 months. I was moving from Pennsylvania out to Kansas City. I was doing like 3 of the major life changes all in a 6-month period. And my health wasn't in the front of everything. And it hadn't really been through college, and it hadn't really been at all in my life up to that point. I did the bare minimum. I did the minimum of treatments, and I took the minimum of medications, and fitness was a little bit of this and that. Nutrition didn't really matter. I was a college student. I didn't care. And so I crashed and burned. My last semester, it was actually 4 months before I was supposed to graduate. I had to be hospitalized with double pneumonia, and I had to be, I was driven from, since my hospital was in Buffalo, when I was going to school in Pennsylvania, and my actual pulmonologist and all that were in Buffalo, I had to be driven from Pennsylvania up to Buffalo, and I was hospitalized for about 10 days. Looking back, it wasn't as big of a deal as it was to me at the time. But at the time, it was the end of the world, as far as I was concerned. I had lived kind of my whole life in the vein of, it's not going to catch up with me, but when it does, it's over. And at that point, not even 20, it had caught up to me, and I felt, I went through this why me, this poor me stage. I was really sick, I really, really was, but I was recovering from it. I was probably 4 or 5 days in, I was on antibiotics and hooked up IVs and all this good stuff for my admission, but it was the first time I'd ever been hospitalized. And looking back and looking at other patients and working with other patients, thousands of patients now, over the last couple of years, I know that a lot of patients are in at 5 years old, 4 years old, 6 years old, all the way through. And it's a regular occurrence. This is the first time I'd ever been hospitalized, and I in my mind, I thought, my overall health, but my lung function took a major hit, a long-term hit. I think my lung function back then was about 80%, and I came out of there at about 65, which is a huge drop. For anyone, it's a huge drop, especially for a permanent drop, something you don't bounce back from. And what happens over time is, scar tissue builds up and your lung function slowly decreases. That's kind of the par of the course as far as cystic fibrosis, and that's something that we fight all the time and try to maintain, is keeping your baseline either the same, fighting everything you can to improve it, but at least keeping it the same so you're basically slowing a decline is what you're looking to do. And ultimately, last ditch, worst case scenario, you look for a transplant. But it's always, even with the successes of transplantation now, it's still a huge risk, and it's still supposed to be, and should be, your last resort. So I hit this turning point, and that's pretty well where I said, okay, this disease has got to, as far as combating it and dealing with the symptoms and prolonging my life as much as possible, I've got to step it up and make this 100% of my time. I've got to not make it a backseat because my future wife is only going to get a couple of years if I keep screwing around. My job, my career isn't going to matter. It's not going to matter if I graduate. All these things aren't going to matter if I don't put this in the front seat instead of in the trunk where it had been. So that's what I did. I started educating myself on fitness, started taking personal training courses, multiple personal training courses, nutrition, lifestyle courses, to really educate myself specifically on how I could find. I was looking for that key. I was looking for the one thing that nobody had thought of, not necessarily a cure for cystic fibrosis, but that one thing that nobody was doing that was going to prolong my life. And I found those things, and those are things that I tried to pass on to other patients and other care providers. I found little things here and there, not things that make a huge difference, but lots of little things that add up, and they have added up to a lot of really good stuff. So that's kind of the gist of my life up to this point. I've actually poured a lot of that information, probably over the last 7 or 8 years, into an organization that I launched a year and a half ago called Breathe Easy With Us. It's a cystic fibrosis support organization. It works to fill a niche that CFF is not filling. They are research driven. They are the ones finding a cure, funding a cure, and so they've oriented themselves to fill that need, and we are an organization to fill the daily quality of life need. So we educate on nutrition, fitness, overall quality of life, and educating both the patient and the care provider onto how to better provide care for themselves and for their patients. So, does anybody got about 10 minutes left? Does anybody have any quick questions?
I have a question. So if you were to receive a lung transplant, would the transplant lung then become scarred down as well eventually?
In the best case, I don't know where I'm looking. Who am I looking at? Are you in the room or just?
I'm in Wichita.
Okay, I was gonna say. Okay, so I'm just looking at the camera. All right. In a perfect world, in an ideal transplant, no. There are patients that are 10, 12, 14 years out, and at 100 or better than 100%, it's weird because it can be more than 100% because again, it's an average. But are running at 110% lung function. That is ideal. That is the perfect scenario. That's when all the antibodies match up, and genetics and blood, everything matches up the right way. And ultimately, transplantation is a very good educated guess. It's still rolling the dice. There are so many factors that go in beyond blood type and genetics and all these other things that are, as far as we know, as far as medical knowledge, beyond those things that they can't measure yet, and they can't get 100%. So you try to get as close to a match as possible, and what happens is those the transplanted lungs will never develop cystic fibrosis again because it's in the tissue of the original patient, not in the transplanted lungs. It can't be infected. What can move over is whatever cultures, whatever Pseudomonas or whatever it is that the CF patient cultures in their lungs, that can eventually spread. And so because it's not an upper airway, you can't transplant, the sinuses and you can't transplant the upper airways, those will eventually migrate down. Now, the upside is there won't be the mucus production and buildup like in a cystic fibrosis patient's original lungs. So you won't ever have that. But the infection can still spread. It can still be an issue. You can fight it back with antibiotics, and that's the ideal situation. But you will always, the patient will always be on immunosuppressants. It's 3 different types of steroids. There's a low level, mid level, and high power steroid that they'll be on indefinitely. And those are to combat rejection. And there's acute rejection that they can hit. You can go into the hospital and hit it really fast, and usually they can stop that rejection and you're good to go. Chronic rejection is the worst nightmare. That's the worst case scenario for a lung transplant, well, any transplant, really. And what it'll do is basically the body is trying to rid itself from its own lungs. It's fighting the transplant, and it will actually attack the lungs and start to damage them because it sees it as a foreign body. And so what you'll have is, instead of, you won't develop cystic fibrosis, you'll develop pulmonary fibrosis. And that can happen over a long, long period of time, 10, 15 years, or that can happen in a month. And it just depends on the transplant. That's why it's such a high-risk surgery. But ideally, no. Like I said, there are patients that are almost 15 years out now that are doing great. But that's a very low percentage.
Can you please talk about the ideal diet, since it looks like you've done a lot of research on the appropriate diet? Because I've heard high fat, high calorie.
Yeah, I could go into a whole long deal. If you guys want me back, please let everybody know, the teachers and everybody else. I also lecture here to the medical professionals, and usually those are open for patients or students to sit in on. So if that's an interest of you, you guys can get a hold of anybody and get my information. Because I could go into the nutrition. It's a whole thing that we talk about. But to give you a general idea, high fat, high calorie is kind of the general preached catch-all. But we're finding that GI systems for CF patients are very, very temperamental. I have been blessed to not have a whole lot of GI issues as far as no blockages. I've never had to have surgery beyond what I had at birth. But we're finding that there are some very specific regimens that different patients respond really, really well to as far as weight gain, symptom suppression, things like that. And some of the ones that and one of the ones that I recommend to pretty well all my CF patients I talk to is cutting out dairy. Dairy increases mucus production, and then cutting out processed sugar, as much processed sugar as possible. Processed sugar is basically fuel for bacteria. So a bowl of ice cream is like fuel for an infection. I love ice cream, that's one of my weaknesses. But I can tell literally overnight, if I've eaten a bowl of ice cream before I went to bed, I can tell that my treatments in the morning are twice as bad as they were the day before. It increases mucus production. I can tell that the infection has increased. My treatment is more difficult. It's more difficult to bring things up. So I maintain a high-calorie, high-protein diet, but I eat as clean and whole foods as possible. I get most of my protein from lean chicken, lean beef, some fattier beef to get in more calories. But I also have weight gainer shakes, protein shakes, different things like that I supplement in. But I've cut out about 95% of my dairy. I'll probably take cheese to the grave with me, but I try to eat that sparingly. Cheese I cut out mostly, and then pretty well any candy. I've cut out all pop for about 1.5 years now, and I have a Pepsi sitting in my fridge for 1.5 years, and it sat there. It's like a testament to me cutting that out. But There are some other things. You know, I came from a bodybuilding background. I worked with a lot of bodybuilders when I was a personal trainer for a while. And so I've adopted a lot of the things that we did for weight gain and mass gain that bodybuilders do. And then with some caveats to help with actual disease. So I encourage a lot of our patients to lean towards a hard gainer bodybuilding lifestyle. You know, you eat clean, but you eat a lot. You eat 4 or 5 times a day. You eat before you go to bed. You eat as soon as you wake up. I can go in deep into it as far as, you know, slow digesting carbohydrates, slow digesting proteins, fast digesting proteins, different things like that. And I have really fine-tuned my diet. But there are a couple of quick ones that I can tell patients, which is generally cut out dairy and processed sugar. Yeah.
What type of CF condition do you have?
508 Del is mine. Delta 508. Okay.
My second question, what is the qualities that you like in your physicians?
The qualities that I like. The number one thing I can tell as far as the doctors that I respect most and I've really enjoyed working with, is taking that extra 2 minutes. When you meet with a patient, you may have 200 patients in your care and you may only have 7 minutes with that patient. In that 7 minutes, when you're sitting down, when nurse case manager's left the room or when she's taking notes or whatever it is, you may have 7 minutes with that patient. But to them, when they're telling you their issues, what hurts, what doesn't hurt, what their problem is, what they're dealing with, that 7 minutes is their entire life. They're dealing with it every single day. And this goes across the board with any disease or any illness, really. Take that extra minute to really listen. Whether your patient is 14 years old, 40, or 100 years old, really listen to it and really see them as a person, not just the next patient on your list as you move on. I tell that to nurses, I tell that to RTs. Because as a doctor, as an RT, as a nurse, taking 1 extra minute to explain why a medication is doing what it does or should do what it should do if it's done and the patient is compliant, taking that extra minute to explain why or how or listen can increase compliance and can increase their daily quality of life when they walk out of that office. They're wanting to take something away and give them 100% of that 7 minutes. That's for me is a huge thing that sets apart a really high quality doctor over just a standard practitioner.
Thank you so much. That's valuable information. Thank you.